Hello everybody, today we're going to be talking about the SBIRT model. Screeners. The screening part of SBIRT model is performed by health professionals using a group of selected standardized assessment tools which are administered to all clients. Such screenings are typically performed during the intake process. Once individuals with increased risk are identified with screening tools, the SBIRT trained professional moves to providing brief intervention and referral components of the SBIRT model. Screeners that are used utilize universal pre-screening and screening with brief validated measures, which are followed up with immediate brief intervention and referral to specialized treatment. Social workers who utilize the SBIRT model utilize an interactive process of practice that includes screening for alcohol, tobacco, and other drug uses. SBIRT screenings use short, reliable, and valid screening tools that are strengths-based, seeking to empower clients. According to the NORC at the University of Chicago, motivational interviewing is used as a supportive skill set when conducting screeners. While conducting screeners, there are multiple steps that you should think about. Step 1, the practitioner demonstrates competence of reliable and empirically validated substance use screening tools and their applicability to substance in various populations. Step 2, appropriately use substance use and other relevant screening tools to address unmet client needs. Step 3, demonstrate competence in SBIRT process in the development of collaborative intervention goals that are based on screening results. Recognize the ongoing dynamic nature of more in-depth assessment that allows for periodic reevaluation of changes in the client's circumstances and conditions over time. And finally, step 5, the practitioner employs awareness and critical thinking skills. Brief interventions. The brief intervention component of SBIRT has been proven to reduce tobacco use, alcohol consumption, and binge drinking among diverse populations who seek treatment in healthcare and other settings. According to the NORC at the University of Chicago and Council on Social Work Education, when implementing brief interventions, social work practitioners follow a research-supported algorithm that guides clients through behavior change with the goal of preventing more severe consequences of substance use behavior. Examples of brief evaluation. So there's 3 different types of examples of brief intervention. Directing, the clinician explains why the patient should make the behavior change. This tells them how to do it and emphasizes how important it is to change. Guiding, the clinician explains why the patient should make a behavior change, tells them how to do it, and emphasizes how important it is to change. Following, the clinician relies on listening to the client, asking open-ended questions, and using person-centered counseling skills. Referrals. Depending on how the individual scores on screening instruments and if the client's substance use is deemed high risk, the clinician will utilize motivational interviewing techniques to assist the client towards a reduction or elimination of substance use and facilitate appropriate follow-up. The SBIRT trained clinician develops a supportive relationship with clients to help resolve any ambivalence the client may be experiencing towards their substance usage. The brief intervention should result in referral of the client to another clinician that is better capable of providing longer-term support for the management of substance use in the case that they are in that higher risk. The referral process. So once using screeners and brief intervention, the social worker determines that the client has a substance use problem or other behavioral concerns that require specialized treatment. So this would look like them being in that high risk area for their substance use or alcohol usage. The clinician then educates the client on why the referral is needed, what to expect from treatment, and what the benefits of the treatment are. So in this process, the clinician is educating them on the risks that they have with their usage of the substances or alcohol, and then kind of letting them guide the conversation on if they're ready for change, what that would look like for them, and kind of directing them through that process. The training that we did online showed a kind of a handout that kind of helped outline when it's time to start kind of having that discussion on when it's time to help guide them in identifying the risk and when it's time to go seek other help and referral. Step 3, the client is then directly connected to treatment providers by assisting with making appointments, providing contact information, helping with other steps to getting them treatment effectively. So this is the best situation would be a warm handoff to ensure that they're meeting that person and there's follow-up right there. It's also important for the clinician to work with the individual. It's not as effective if the individual is just giving resources and is supposed to be setting out on their own to get these services on their own. It's best practice if the clinician or the provider is working alongside them, calling that day and introducing them to the different providers or the resources and getting the process started that day. And so that's called a warm handoff. The social worker will then check in with the client and treatment provider to monitor progress and ensure continuity of care. So they also, before they leave that day, a plan will be made to ensure that they have a clear understanding of what they need to do and what the next steps are for them. And then the social worker or the provider will make a plan to follow up to ensure that they're doing okay and to see if they need any further resources. Best practices. Social workers conducting referrals are to ensure the client is involved in decision making, to respect their autonomy, and to build trust. It's important that social workers refer to services that are culturally and linguistically appropriate for the clientele they are serving. It is also critical that social workers clearly communicate detailed information about the referral process and the expectations of the client. So in this, if the individual is high risk and they express that they are not ready to go seek help or assistance, it's best if the provider just gives the resources and lets it be and lets them go. It's all about autonomy and informing them of the resources that are available to them and their risks. But it's also important to respect their autonomy and their decision-making process. So, all right, thank you.